Welcome, everyone, to the webcast series, The Public Health Insider. My name is Casey Farm, and I am the Director of Alumni Relations for the College of Public Health and Human Sciences. I am absolutely delighted to introduce the moderator for today's episode, Does Your Home Pass the Test? How Environmental Health in the Home Can Affect Child Development. This is the third and final webcast of our second season of the Public Health Insider series. As a reminder, you can always watch previous episodes from this season and the previous season at osualum.com/public health webcasts. Our webcast series is hosted by the OSU Alumni Association in collaboration with the College of Public Health and Human Sciences and the OSU Center for Health Innovation. We are very excited to return this series surrounding public health, what it is, why it is important, and how it applies to our lives and our communities. For more information on public health and all the other incredible work that's being done in the college, please visit health.oregonstate.edu. Now on to today's moderator, who will introduce today's topic, and our panelists. Our series moderator is Dr. Allison Myers, and she is the director of the OSU Center for Health Innovation in the college. The center serves as the connector between external organizations and Oregon State University faculty in the discovery of innovative solutions to pressing health and wellness issues, and helps to build the workforce capacity in public health and human sciences. In service to meeting the most pressing public health needs in the state of Oregon, the center is home to projects related to COVID-19 response, including TRACE, which is a public health surveillance project. Other projects include promoting mental health and preventing disordered substance abuse in rural Oregon, and addressing food security in partnership with retail store owners, local public health authorities, and a coordinated care organization. It is now my pleasure to introduce and turn the webcast over to Dr. Allison Myers. Welcome, Dr. Myers. Glad to have you back today.
Thanks, Casey. It's a joy to be here. We're getting into a routine. Season 2, episode 3, the third of 3 in this particular series. I am so pleased to have 3 of our faculty members here today, and I'll introduce all 3 of them before I turn the mic over. But I'd also like to begin with an acknowledgement of the land on which many of us are sitting today. Oregon State University in Corvallis, Oregon, as many of you know, is located within the traditional homelands of the Marys River Band of Kalapuya. And following the Willamette Valley Treaty of 1855, Kalapuya people were forcibly removed to reservations in Western Oregon. Today, living descendants of these people are part of the Confederated Tribes of Grand Ronde Community of Oregon and the Confederated Tribes of the Siletz Indians. The location of the OSU Cascades campus in Bend stands on land that historically belonged to the Wasco and Warm Springs nations. It was the 1855 treaty with the Middle Bands of Oregon that moved people of the Confederated Tribes of Warm Springs to the Warm Springs Indian Reservation. Again, my name is Allison, and I'm pleased to introduce our 3 panelists today. I'm going to introduce them in the order that they're speaking, and notably, each of them are part of the Hallie Ford Center for Healthy Children and Families here at Oregon State University. The Hallie Ford Center promotes the development and well-being of children, youth, and families by generating, translating, and sharing research-based knowledge. The center advocates a holistic and interdisciplinary approach to their work, and hang on to that interdisciplinary part because you're going to see and hear more about it today. I also want to recognize that our College of Public Health and Human Sciences is home to faculty at both the Corvallis campus and at OSU Cascades. So Shannon, thank you for representing our colleagues in Bend today. Panelists, I'll invite you to go ahead and turn on your video as I introduce you. First, we have Dr. Molly Kyle, Associate Professor in Environmental and Occupational Health. Hi, Molly. Molly's an environmental epidemiologist who's studied the effects of environmental pollutants on children's health for 15 years. Molly works with communities in the United States and abroad. For example, she works with community partners in Bangladesh to study the effect of arsenic on maternal and child health. Molly also serves as an officer as an environmental quality commissioners, one of 5 of them for the state of Oregon Department of Environmental Quality. Thank you for being here, Molly. Second, we have Shannon Lipscomb coming to us from OSU Cascades in Bend. Shannon is an associate professor and program lead for human development and family sciences at Oregon State University Cascades. Dr. Lipscomb teaches undergraduate courses in infant and child development, research methods, grant writing and program development, and families and poverty. She also conducts research and mentors students in research on early childhood development, early care and education, and home environments. Dr. Lipscomb also studies resilience, what it is, how it's measured, and how you can build it in children. Thank you for being here, Shannon. And finally, we have Megan McClelland, the Catherine E. Smith Professor of Healthy Children and Families at Oregon State University College of Public Health and Human Sciences, and Endowed Director at the Hallie E. Ford Center for Healthy Children and Families. Dr. McClelland is a developmental psychologist with 19 years of experience in optimizing children's development and working with children and families in early childhood contexts. Her research focuses on children's early life exposures and links between self-regulation and executive function and developmental outcomes. And I just learned yesterday or today, Megan, that your measure that you worked on of executive function and self-regulation is used around the world and is measured in 28 languages. I'm thoroughly impressed. Thank you very much for being here.
Thanks. Thanks for having me.
To our audience, this is your friendly reminder to please send in your questions. There's a Q&A feature. It's there in the bottom of the Zoom screen, and we look very much forward to interacting with you after we hear from our speakers. So I am going to turn off my volume and hide my video, and Molly, I'm turning it over to you.
That sounds great. Thanks, Allison. Thank you for the introduction. And let's try the first piece of technology with trying to share my screen. So can I get a thumbs up from Shannon if this is visible? Perfect. Thank you. So as Allison mentioned, my name is Molly Kyle. I'm in the Environmental and Occupational Health Unit in the College of Public Health and Human Sciences, and I'm an environmental epidemiologist. So a large part of my research and my training is trying to understand how people are exposed to pollutants and chemicals in the environment, and then designing population-based studies to try to quantify the effects those exposures have on human health outcomes. As we were kind of planning this talk, Shannon, Megan, and I thought that people might be interested in hearing how we came up with this idea of this study that we're going to be talking about in the first place. And so we're each going to kind of share a little bit of a background about what we are, who we are, and why we are interested in home-based hazards, as well as the research project that we have underway that is funded by the National Institute of Environmental Health Sciences to investigate some of the hazards in the home and how those might be affecting children's health. So I'm up first. And most of you probably know me for the work that I do in Bangladesh, if you've ever heard of me at all. But this is kind of the home environment that I work in most of the time in Bangladesh. A lot of my research has been conducted in these types of low income settings and in communities that have been impacted by poor water quality in particular. So these are environmental justice communities. And in Bangladesh, the issue there is arsenic contaminated groundwater. And as a move to try to prevent waterborne illness, which was a devastating impacts in kind of the 70s, the start of a lot of the international aid when Bangladesh became a newly formed country, one of the first public health initiatives that went underway was really switching the population from surface water to groundwater. And unfortunately, nobody ever tested the groundwater for any hazards other than the bacteria that was causing a lot of that waterborne diarrheal disease. And arsenic is very prevalent in the groundwater under Bangladesh. You don't know it's there. You can't see it, you can't taste it, and you can't smell it. And after about 10, 15 years of this chronic exposure, there was a lot of illness, disease, disability, death, cancer that was unexplained. And so when I started my career, it was really about trying to understand, was it the arsenic in the drinking water? Was this related to the health issues? What do we go about, how do we start to solve this? And what turned out to be the largest mass poisoning ever in the world. And so, here's just one of the photos from my most recent study that we just wrapped up, which was looking at the effects of arsenic exposure in pregnancy on the health of the children. And so we were looking to see whether this was related to people's immunological functioning and their ability to mount a vaccine response. And the punchline of that is it is related to that. So one of the reasons you might start to see waning vaccine responses in the public has to do with some of the environmental pollution that they're exposed to. So it is kind of timely as a lot of us are thinking about vaccines, efficacy, and environmental pollution. So this is one typical home environment. And what really motivates a lot of my research and a lot of my public health is this statistic that was developed by the World Health Organization, which said that reducing environmental risk could prevent up to 25% of the disease burden in children under 5. So we know a lot of hazards in people's homes environment, as well as the ambient environment that affect children's health. A lot of this disease burden is from waterborne disease in kind of those developing country situations that really only economic advancement and safe water programs will resolve. And this is a huge opportunity, though, for public health. Like, we could make children around the world healthier by reducing their exposures to these known environmental hazards. So things like water quality, air quality, lead paint, accidental drowning is a top one. Those types of things have a huge global burden. And they're also true here in the United States, just they look maybe a little bit differently. So the home environment in the United States is different. It is much more modern. And when I look at this, I still see those same traditional hazards, though. I see a fireplace that could be contributing to indoor air quality. I wonder about the quality of the drinking water that's coming into this home. I wonder where this home is located next to industries. All of that kind of goes through my head because I am trained so much in environmental toxicology and environmental health science. What I also see in this home, though, are new hazards that we don't really necessarily know if they are harmful yet or not. All of this beautiful furniture is soft and cushy, and it's wonderful, and it's wonderful. But there are rules and regulations about fire safety. And one of those rules and regulations about fire safety to reduce the potential damage of those acute environmental hazards like a house fire is the addition of chemicals into foam-based furniture in particular, but also the insulation in our walls and even the carpeting and the flooring underneath the carpeting, which are these flame retardant chemicals. And we don't really know much about them other than the fact that everybody is exposed to them. We don't know how much exposure is harmful yet, really. And so this is what kind of motivated a modern study in the portfolio. And the real question is, what do we do about it? So the way environmental regulation really works in the United States is kind of, you have to first prove harm, and then you go about trying to mitigate that, usually through engineering solutions of getting rid of the environmental hazard from the products and thereby protecting the entire population. But that's a slow, cumbersome process. And you still have the issue of what to do now, because if these are in our products and exposures are happening to all of us right now, they're happening to me sitting on my cushy chair, is there anything that we can do now to reduce these exposures? So about 10 years ago, I attended a lecture by Tom Ghiarti, who is an amazing toxicologist. And he really changed my way of thinking about environmental health science. What you see here is a picture of a traditional toxicology setup where you have animals in a very sterile environment. They're not allowed to be interacted with. and they're kept up on a shelf. And that's where a lot of our regulatory toxicology information comes from. But we know that the real world doesn't look like a mouse cage, or it really shouldn't look like a mouse cage. And so Tom really started these environment stress interaction studies, which were very groundbreaking in the toxicology world. But as somebody who studies people, I started to think, oh, actually, we need to start looking at stress. We need to look at it both as a negative as a positive. I had never thought about the social factors before. I was always so focused on my pollution. And when I came to OSU, I had this amazing opportunity to meet Shannon and Megan, who are up next, who are all about that social environment. And part of the project that we're working on today really brings my pollution together with their social stressors in an attempt to try to understand what some of those modern environmental exposures in our home do or don't do to children's health. So he really got me thinking about stress, and it was this study in particular. So I apologize for, I can't help but throw a little bit of data on there. But what this study did, and this is the one that really changed how I thought about this, was he did a 4-group study. So he had 2 groups that were lead exposed animals and 2 groups that had been exposed to lead. And lead is a known neurotoxicant. Its effects on health are very well described. He also, though, the trick for him was he took 2 of those groups and put one in a socially enriched environment and one in the traditionally socially isolated environment. And then he put them through a water maze. And a water maze is a very standard animal model experimental design where you put a little mouse in a pool of water and you time how long it takes them to stand up onto a little platform. And mice are good swimmers, so they don't really mind the experiment, but they also don't really like to get wet. So they typically will find the platform as quickly as possible and stand on it and kind of basically tell the researchers time's out, put me back in my cage. So what these 4 groups did is what you see here, which is those animals that were not exposed to lead, so the control animals that lived in a socially enriched environment, they had the steepest, they learned the maze the quickest. And they hit the criterion by day 4. And you can see that slope of the line. The steepness of the slope of the line really indicates how quickly the animals learn to navigate the maze. What surprised the heck out of me was that those animals that had been exposed to lead and upon biopsy indicated they had the neural pruning that is typical of lead exposure. Well, they hit the criterion in 4 days too. They were a little slower off the start, but that social enrichment increased the neuronal capacity and they could learn ultimately as quickly as those controlled mouse, even though they had been exposed to the environmental hazard. Those animals that were in the socially isolated boxes, but were not exposed to lead, they learned pretty quickly, but you can see that they actually never hit the criterion. So even though they didn't have the toxic exposure, that social isolation had an effect on their ability to quickly learn the maze. And then those little animals that had been lead exposed and socially isolated, just, they could learn, but it was just a really slow and flat process. So it would take a lot longer ultimately for them to figure out the maze. So in my head, this was groundbreaking, and not just my head, because it really gave this notion down here at the bottom of the table that, well, while these chemical exposures are happening, social enrichment might be another public health lever that we could pull as a society to help negate some of this toxicity while the environmental regulatory world moves and tries to remove these hazards for our environment. So that's really what led to this flame retardant study and children's school readiness, which is what Shannon and Megan bring to the table. And this study is just underway. It's going to be, we'll have some results in about 5 years. And we're going to be recruiting children across Oregon, or at least in Corvallis area and Bend area. We're going to be measuring their exposures to flame retardants using this little bracelet right here, which was invented by Kim Anderson over in the College of Agricultural Science here at OSU. And we will be testing their school readiness skills using the expertise of Shannon and Megan. So I'm excited to get this going and really try to understand the effects of chemical toxicants in the real world. So with that, I'm going to turn it over to Shannon, and I'm going to mute myself, but I will control the slides. So Shannon, when you're ready for the next slide, just let me know.
Great. Thank you so much, Molly. Hi, everyone. It's really nice to have a group with us here today. My name's Shannon Lipscomb, and as Molly said, I study social environments and early development. So I study both risks, or we can call them toxins, in our social environments, and also resilience. So we'll start with an introduction to risks or toxins in our social environments. So you may be familiar with this concept of adverse childhood experiences. Since a landmark study in 1998 was conducted, we often call it just the ACEs study by Anda and Filiti, we have known and have more and more research really every year, and certainly across decades, that these adverse childhood experiences that are shown on this slide surrounding the tree, that they impose challenges for health and well-being of people of all ages. So the more ACEs that we experience early in life, the more likely we are to develop physical health problems like cancer, diabetes, heart disease, and many other illnesses, as well as mental health challenges and even premature death. And then our science has further been developing, and this is a graphic that's developed by Dr. Wendy Ellis at George Washington University to communicate this concept of a pair of ACEs, that we also have adverse community environments. And here we're still looking at those social environments that are occurring, we can think about them in the soil of our society. And those adverse community environments, like violence, like poor quality of housing, like discrimination, they are directly contributing to these adverse childhood experiences and also increasing the impacts of those adverse experiences. Additionally, although we know that children of any socioeconomic class or income level can experience these ACEs, they're more frequent and more common among communities of color and communities facing low income because of these adverse community environments that families and communities are facing. So you can learn more about that. I have actually provided, which you'll get follow-up links, some information so you can explore. There's a lot of research on ACEs. It's very interesting and important. I actually study ACEs in early childhood as they're occurring. So in a recent study we conducted here in Central Oregon, we recruited early childhood teachers and child care providers into a study. They're from all different kinds of early learning programs in Central Oregon, but they came into the study because they're interested in learning about ACEs and about trauma and about resilience. And in the children that they're caring for, those that participated in our study, we found already that 65% of them at age 4 had experienced at least one of these ACEs, and a third of them had 3 or more already by about average age of 4. And there's been studies done in Oregon statewide of 11th graders, and a couple of examples of statistics that have come from that. I think it's called the Oregon Student Wellness Survey. And some of that research just shows that 40% of 11th graders statewide have lived at some point in their life with a parent or a caregiver with a mental health challenge, illness, or depression. And over 30%, I think it was 34%, had lived with someone with a substance abuse problem or problem drinker. So these are common occurrences. They're common toxins in our social environments. And we can think about them as toxins in a few different ways. So they get in under our skin, right? They're not just experiences that happen here outside of us. They get in under our skin, kind of like those toxins that Molly's talking about. And they affect our stress response systems, they affect our immune systems, and they affect our brain development. Okay, next slide. Fortunately, ACEs are not our destiny. So I mentioned that I also study resilience. And as scientists, we define resilience as positive adaptation in the face of adversity. So one of the most powerful things about resilience is that it's not an outcome, it's a process that can lead to really almost any kind of positive life outcome that you might care about or that you could dream up. These are just a few examples that I've put here on our slide for us to think about. You probably know, most of us can think of someone in our lives who has overcome great odds to achieve some version of success or happiness or well-being in their life. You know, that can be a teenager who bounced around from home to home, but because his parents maybe were incarcerated or had a substance abuse problem, but received sufficient support and opportunity in life to be able to graduate from high school and get a scholarship for college, right? So we can think about those kind of success stories when we think about resilience. And then when I think about those rats that Molly was just talking about, those lead poison rats, right? So their adversity is lead poisoning. But the group of them who had the opportunity to have that enriched environment, they learned to find that platform in that water maze, right? They were adapting positively in the face of adversity. So that's what we're talking about here. So we'll go to the next slide. Okay, my very favorite thing, I have a lot of favorite things about resilience. My very favorite is that it is something we can actively nurture. So resilience is something that every single human being is capable of, every one of us. And that's because it's a natural human process. It's not a personality trait that we either have or don't have, or that only some of us have. But it doesn't just happen by a miracle by itself, right? So it has to be nurtured. Okay, next slide. So how do we nurture resilience? We can nurture resilience through protective factors, and we can organize those into 3 different categories. Really, in a nutshell, it's thinking about the people and the places in our lives. That's how and through the ways in which we develop and nurture resilience. So first is individual skills and perspectives, and those are things like self-regulation, getting along well with others, and having a growth mindset, which is that perspective that I can greatly improve my abilities by trying new things and learning from my mistakes. Then we have social relationships and connections, which are really truly the heart and the center of resilience. And that's because those social relationships that are supportive not only are protective in and of themselves, but they are also the place in which, in the way that we develop those individual skills and perspectives. And anyone, really, truly, it can be family members, it can be adults, it can be siblings, it can be peers, it can be coaches. Any important, caring, consistent adult in a child's life can be that social connection or relationship that protects and nurtures resilience. And then we have community resources and supports. And these can go a really long way to nurturing resilience, particularly when they foster a sense of belonging and a sense of knowing where to go to get help when we need it. So think of libraries, health clinics, parks, church groups, and broader social forces like culture and experiences in society, like being treated fairly. Okay, next slide. So these are just a few things. There are many things we can do in really any social environment. I study homes and early childcare and preschool programs, and I've shared just a few images here to remind us of some things that we can do in any home environment. And I picked these because they're evidence-based, and also that although I'm thinking in particular about early childhood, these matter at any age. So in the top in the center, we see a mom. She's being sensitive and responsive and nurturing to her baby. In that moment, she's doing a couple really important things that we can all do as caregivers for one another. So she's providing that warmth, that bonding, that attachment with the baby. She's also helping to regulate that child's brain. So when we think about that child having a distress from something as simple as a wet diaper, to some bigger stress that might be really big and large in their lives, the mom is helping the child's body and brain to be regulated in a way that when that happens repeatedly over time during early childhood, the brain and body are more likely to be regulated. They're used to that regulation, and that's more likely to be repeated as she gets older. But again, it's important for us at every age. We move to the right, and you can see this empty cup, right? We cannot pour that kind of love and support and nurturance when we don't have a reservoir for ourselves. So we must take care of ourselves. And that includes, you know, those kind of traditional suspects. We want to be eating well, getting enough sleep, doing some breathing exercises, getting some physical activity, but it's also not just up to us as an individual. So we need to activate those social support networks, like those community factors mentioned on the last slide. And then we go down to the bottom right, and we're looking at having some sort of refuge, some sort of cozy corner, some place to get away from the stress of the world, kind of tune into ourselves or lose ourselves in a story. At the bottom middle is one of my very favorite children's books called Moody Cow Meditates. And I have it here as a marker for a couple things. One is the importance and power of shared reading when we're young. So it supports not only literacy, but also that bonding relationship. And also I chose this one because it's a book about emotions. So having ways to talk and share and find words to give meaning to our really complicated experiences of emotions in our world is very important. And we can do that with simple books with young children, and we can have more complex conversations with older children or adult members of our families as well. And then finally, Moody Cow also incorporates this idea of mindfulness. So I encourage you to check out this Moody Cow Mind Jar. It's really just a way to encourage in a very tangible, concrete, visual, and hands-on way to be thinking and practicing mindfulness in early childhood. Okay, and finally, routines. So routines provide a sense of predictability and stability, which is super important for children who experience adversity. It's also important for all of us. And for young children, routines help us also a sense of control because they show us what's going to come next. We can feel in control of our lives when we have some predictability in what's coming. This is also a reminder of the importance of rules and boundaries and limitations, and routines can be a really nice way to do that. So we can think about, you don't have to have lots of them, right? You can think about a couple important routines, like maybe one shared family meal a day, maybe a routine like shared reading before bed or bath or something like that. Okay, we don't have to have a whole schedule, just a few routines that help to ground us. Okay, next slide. So this comes to this research question, this study that we're engaged in right now. So I've studied, and my colleagues have studied these social environments. We know that they can be protective against social toxins or social risk factors. We have no idea yet whether they can be protective also for chemical risk factors like chemical flame retardant exposures. So that's what we're investigating now. We're looking at average childhood experiences, chemical flame retardant exposure, and these social protective and resilience factors, and how all of those things combine together to explain early learning and development. So for more on that, early learning and development, I'll turn it over to Megan McClelland.
So I'm going to focus on, and I circled that one because the way where I come into this is sort of to complement the other two speakers that you've already heard from, but I focus more on a child's individual skills that they bring to the table and how environmental toxins might influence the development of those skills. So next slide. And that's where we have brain development. Brain development, why are these skills important? Because, and especially in the early childhood years, because the early years are a real sensitive period for the development of a child's brain. We all know this, but what really happens in this, if you can see this in this graph, great. So why do we care about these skills these individual skills? Mostly because of this importance of brain development in the early years for a child. And what we've been really interested in is how these aspects of the environment, like social adversity that Shannon just talked about, and then also how environmental chemicals might interfere or affect or influence the skills that kids are developing in this very early part of their life. So if you look at this slide, what you see, the pink part of the slide is really, that's a whole bunch of stuff happening in the first year of life. And if you just even look out to up to age, at the bottom across where it says years, if you look up to, age 6, 7, 8, 9, I mean, there's so much happening in those first years of life. And it's a little scary, I can just say as a parent, to think about how things in the environment that we don't ever think about, like chemicals like flame retardants, could be affecting my child's development of their language or their cognitive skills. So that's one of the reasons why we got particularly interested in doing this study, and it was a great interdisciplinary collaboration. So you can go to the next slide. So the skills that I tend to focus on and are self-regulation and executive function, which really is how we control our thoughts, feelings, and behavior. Sorry, you can go back, Allison. And what this means is this really means for a child, can they control themselves? Can they pay attention? Do they remember what they need to do, and can they follow through? And any parent will tell you, and any teacher will tell you how critical these skills are. And also, we are really interested in the emotional, social emotional skills that Shannon was also talking about, which is how well can kids get along with others, how well can they cooperate, and can they work well together. So you can go to the next slide. And why do we care about these? Well, it turns out, and how are these things connected? It turns out that these skills predict a variety of incredibly important outcomes, like a child's own social competence. It turns out they're really important for your health and obesity. It turns out that they're important for short and long-term success in school, of all things. So in one study we did, the child that was rated as really having strong attention and being able to persist when they were just 4 years of age, those children had nearly 50% greater odds of finishing college by the time they were 25. So there's something really important about the development of these skills. And there's also a lot of evidence showing that these sorts of foundational social and cognitive skills in a child are really important for long-term health and educational outcome, wages, employment, and well-being. So there's one more, I think, Allison, there you go, on that slide. So for all those reasons, we know these are really important skills to have for young kids. And what we were really concerned about is, well, what might be influencing the development of these skills. Shannon and I's work is very complementary in looking at the social adversities and the other kinds of factors that can influence these skills. But the idea that maybe there's something in your environment and I'll just quickly say that I didn't really understand this impact of this until Molly came into my house one time and looked at my couches and said, "Oh, those look like nice couches. They're full of flame retardants." And it completely freaked me out because I had 2 young children at the time. And it's this question of, well, how is that related to their developing brain and these foundational skills? And it turns out that there are links between their behavior and some of these toxins. But there's also a great buffering effect of the environment and good parenting and other good things you can be doing to help mitigate that. So that was one of the reasons why we all started talking together. And if you go to the next slide, that's where this study came about, where we were really looking at the effects between these chemical pollutants in the environment, social adversity, and then children's social and behavioral development, using these great innovative wristbands that you can see here in this picture, which basically just suck up everything a child's exposed to for a week. And then they tell us the kinds of chemicals that a child is exposed to. And then we are able to look at how that might impact and affect that child's social behavior and cognitive skills. So I think with that, I'm kind of, that was the end of our presentation, but I'm happy to open it up at this point for questions, or if Molly and, or if you want to ask any questions, Allison.
I do. Thank you all so much. Let's have the audience give you what amounts to a quiet round of applause.
This is the strangest format, isn't it?
Yeah, for persevering through the technical challenges. We have some questions that have come in from folks who registered. We're gonna go to those first, and then there are some folks who've typed in their questions. Shannon, I see that you've attended to one. We may or may not talk a little bit more about that. But this is the chance for those of you in the crowd to please don't be shy. Every question is a good one. We'd absolutely love to hear from you. And you just use that Q&A box, that feature down at the bottom of the screen. So let's start with Molly, I'm coming to you, and I want you to respond to a statement that we got. It's a statement and a question, and they're both coming to you, that we got when folks registered. And one of them is, I am very concerned about the use of common household bleach, especially with kids in the house. And this person knows certainly more than I do, because I don't know what SDS is. So I'm going to have to ask you to explain that. The chlorine is heavier than air, and the SDS for this product is alarming. Molly, help us out. What do we need to know about bleach?
Yes, and hopefully everybody's using some of it these days. So the SDS refers to a safety data sheet. Every chemical that is produced and is available for purchase has safety information on it. Often it's on the label, although sometimes you do need to download these safety data sheets, and it includes a lot of that chemistry. Things like vapor pressure, things like toxicity, things like what to do for an acute ingestion. We do know that bleach is a toxic product if it is not used properly. So the message I would prefer to talk about is how to use bleach safely, because it is a very effective disinfectant. And a lot of us are hopefully spending a lot more time thinking about disinfection right now as a mitigating factor against the spread of COVID. So bleach is a chemical. It needs to be treated with respect and responsibly. If it does get into your eyes, or there's an accidental ingestion, then there is a number on the back of the bottle to call to get information for those types of acute ingestions. That's what the safety data sheet is really kind of referring to. But when it's used properly, according to the instructions, which is as a dilution, usually it's a pretty weak dilution, like a 10% solution, 5% solution actually is enough to disinfect against any type of actually microbial use. So, a 10%, 5% bleach solution is what's used to disinfect against Ebola. It's part of the process. So it's about knowing how to use that chemical properly. Making sure that it's stored where children can't get to it and accidentally ingest it. Make sure that when you use it, you've washed your hands afterwards. Make sure that you're not spraying it in your face. When you do use it, you can always smell it, right? It has a very strong pungent odor. So just make sure that you're using ventilation, open your windows, turn on your extractor fans if you're using it in your in confined spaces like bathrooms. Make sure that you vent it out, and then it is being used properly, and then it is a safe solution to disinfect.
That's so helpful. Thank you, Molly. One more that came in, another question about common chemicals, I'll say, in our houses, and another one that's highly relevant to COVID-19. With all the use of hand sanitizer, and Shannon and Megan, you might want to weigh in on this one too, is this constant exposure to alcohol projected to have any impacts on these young kiddos as they grow? Thinking about short-term and chronic use. What do you think? Let's start with Molly and then maybe have others weigh in.
Yes, that's another recent change in our labs, right? We're using a lot more hand sanitizers. I'm going to actually, again, kind of flip this question a little bit, because in those low-income environments that a lot of my research is, which is kind of actually slums where there just isn't infrastructure, there's been a lot of studies, how do you reduce infectious disease spread in those types of environment where you can't do infrastructure improvement, or it's going to take a long time and a lot of political will to upgrade. In those situations, the answer is soap. And there are lots of studies. The Karachi soap study is one of the most famous in my world anyway. And it shows that simply using soap correctly can reduce diarrheal incidence and respiratory infections like pneumonia by 50% without changing the rest of your environment. And it does that because soap is very good at disinfecting surfaces, including your hands. So I think everybody was awash with wash messages back in March about how to make sure that you properly wash your hands with soap, which is 20 seconds, all surfaces. There's songs now about it. Sing happy birthday to yourself, and you live to see your next birthday is how I've been explaining it to the little kids in my life. But it is this notion that soap is actually the best disinfection against a lot of COVID. So I would actually encourage people to try to use soap whenever possible, because it is actually more effective than hand sanitizers. However, hand sanitizers are convenient because you don't need to have running water to use them. And so again, use them according to manufacturing processes. And when you're dealing with little kids, you need to kind of pay maybe a little more attention to it. When they come home, wash their hands, and then you've removed the hazard. What the long-term health consequences are, I don't think that's a question that anybody can really answer with much certainty at this point. I think the risk personally is quite low, especially if people are using it as, again, directed by the back of the samples. But I'd also encourage people to just use good old-fashioned soap and water whenever possible.
Thanks, Molly. Megan or Shannon, anything on hand sanitizer?
Shannon. I'll just chime in to say that, it can get old sometimes to have to continue to do those hand washing routines with young ones, but it is a routine, right? And we mentioned routines earlier. If we can turn it into a little ritual, we have a song that goes along with it, and we empower children that this is the way we can take control in our environment in a time that could be otherwise really scary and uncertain. We can actually do something that really makes the difference by washing our hands. So we can look on the bright side of that too.
Yeah, it's certainly a nice protective behavior. And I would be remiss if I didn't plug the rapid hand washing guides that our Family and Community Health Extension folks have put together and are in use. And it occurred to me, I don't have children, I'm not a school teacher, but if you need to get 20 kids hands washed effectively and quickly, how do you do that? Well, Extension can give you the guide complete with visual tutorial, I think. So Casey will have to add that to the show notes, so to speak, to the follow-up. We've got some great questions. Thank you so much to those of you who are telling us, giving us written claps. We appreciate that. Barbara would like to know if the special bracelets can measure exposure to chlorine bleach.
As far as I know, no. Kim has done some amazing work on that chemistry field, and she does have methods now that can measure up to 1,500 different chemicals. And a lot of those are things we don't think about and that are found in our consumer products. But as far as I know, she can't measure the chlorine because it is a gas and it's a super light molecule that doesn't really diffuse well into that, and also doesn't extract out of that silicone very well. So I do not believe it would work on the chlorine. There was a question in the chat a little bit about talking about the other components, not just the ethanol that's in hand sanitizer, because a lot of those products do have fragrances. And fragrances are one of the modern chemicals. There is some health studies being done on those, and there is information that is being gathered. The wristbands do work quite well on measuring those kind of fragrances, and that is one of the more common exposures people do have. Again, that's why, like if this is a concern, I would again recommend just using unscented products and, good old-fashioned plain soap.
Yeah, thank you, Molly. I so appreciate the comments coming in the Q&A. I want to just go ahead and draw our attention to them. Thank you, Ricardo. Metro Regional Government is hosting a webinar next week titled Cleaning and Disinfecting for At-Home Education or School-Based Education. Some of you on the webinar today may be quite interested in that. And then, oh gosh, here's one. I've heard that oil diffusers are bad for children and even pets. Is this true? And while we're at it, can you talk about those ones that you plug into the wall that really make a lot of smell?
Yeah, so I'm personally not a fan of fragrance-based products, even though they are very common and they're sold, especially for children that might have respiratory conditions like asthma. There is evidence that homes that use a lot of those fragrance products do exacerbate asthma incidence, for instance. And usually you're using a fragrance-based product to cover up a smell, right? And so you're not really getting at the root cause of the environmental issue in the home. You're just kind of masking it with another chemical product. So that's where we're trying to kind of understand if your home is smelling musty, look for leaks, look for mold, try to address the moisture issues in your home, make sure your gutters are clean, things that might cause water to pool. And a lot of those musty odors need water to create the mold that creates the musty odor. So trying to think about those protective factors, those prevention factors that are upstream is a big part of environmental health science, and not so much thinking about how you would cover them up with fragrances. So yeah, I'm not a fan of those products.
So I'm thinking of a product that we're not going to name. You all, you're wonderful. We're so glad you've been here. I want to be mindful of time, and I have one more question that, at the risk of repeating, I'm going to come around to all of you, and that is, what is it that you do differently? Maybe one or two things, or that you encourage your friends or family to do, whether it's for your own kids, your neighbors' kids, your nieces, nephews, nibblings, you name it. What is it that you do differently now that you study environmental toxicants and child development? And who would like to start? I'd love to hear from all three of you, and then we'll turn it over to Casey. Megan, you go first.
I'll go first just because I mentioned the couches. And I just have to say that the minute that Molly said our couches were full of flame retardants, not only did I sort of freak out and worry about my kids, as you know, I'm already kind of that kind of neurotic parent, but I said to my husband, well, obviously we need new couches. And then I felt like a crazy person when I went into the furniture store and I said, do you have couches that don't have flame retardants? And they just sort of looked at me and I said, so I'm not crazy. Let me just tell you what I mean. And I was able to get, and now they actually, this was a little while ago. Now they have brands that obviously have these lines of more natural products, but I think all IKEA also, is that right, Molly? I think they don't have them in there either. But anyway, we were able to find some nice sustainably built couches. So that's one thing that we did pretty quickly.
Thank you so much for that. Molly or Shannon?
I want to go next because one of the things in my world, like I can ruin anybody's day in like 5 minutes walking into their home, like I did with Megan. So I actually took the flip because I absolutely believe that environmental regulation is the way forward, but it is slow and it takes a lot of evidence so that we are making evidence-based decisions and not just kind of freaking out a little bit about the chemicals that are around us. So I look actually at Megan and Shannon, and I'm like, oh my God, Head Start for everyone. You know, like what can we do to enrich children's environment? Because that little mouse found the platform in 4 days too. Like, how do we float the boat socially for everybody? And those are things that we can do right now. And there are actions that we can take right now that, you know, might help to reduce some of that variability that we see in populations because of the environmental toxicant. So I love working with Shannon and Megan, not only because they practice what they preach, and this is like the most wonderful, supportive group to work with. I also think that their solutions are things that we can work on as a society more quickly, perhaps, and even in parallel to some of those upstream environmental causes.
Of course. Yeah, I think about multi-level approaches, right? Facing problems from different angles. Shannon?
Yeah. Well, I'm a resilience researcher, right? So I acknowledge the toxins, and I now have even more reason to care about resilience because of the chemical toxins that honestly I really didn't think about that much before I started working with Molly and studying with her. So in my own personal life, just trying to hold on to what's working and the sense of control that I have over the toxins, whether they're social or chemical in my life, is to take care of myself and take care of my loved ones, and just really trying to be pouring in love and caring in the moments whenever we can. So even just trying to take those moments in our team meetings to connect with one another and support each other. So
it's wonderful. And thank you for giving me the name of my cozy corner that I have in the back, in the back of my office. You all, this has been fantastic. To our audience, thank you. At the risk of going long in 15 seconds, is there a way to test your house for mold in the air? Can you get a kit somewhere?
Oh, actually, the recommendation is not to test for it because mold is everywhere. So if you walk into a space and it smells musty and moldy, you've got it. So your
Okay.
nose is actually your best sensor for that. And the issue there is now moisture control. So it is paying attention to your gutters, your windows, places that moisture pools up on, especially as we kind of start moving into winter. When you get those temperature differentials where your house is warmer than the outside, you get condensation around your windows. So a lot of that, again, is built environment features. And it also, then the solutions run the gamut depending on your socioeconomic status and how much you can afford to put in to your home. But it is about moisture control. So dehumidifiers, ventilation, double pane glasses, trying to find if you do have a wet, damp corner. And if you do, the answer is really to try to remove the moisture, and that will kill off the mold.
Thank you so much for answering that question. You all, Casey Farm is going to come back on, and there'll be lots of follow-up in the emails, I think, too. Thank you, everyone.
Thank you very much. Thank you to all of our panelists, and thank you to our registrants and our participants. You are all awesome, very active today. A lot of really fantastic questions. We'll have a lot of in my follow-up to each one of you. You'll be getting an email from me in a short period of time. There's lots of different research articles and things that you can kind of catch up on that each of the panelists have provided. So we'll have lots for you to read up on. Just consider it your homework from these amazing educators. So anyways, thank you again to our panelists. And again, you can catch up on this episode because it is recorded. So if you want to watch again, you can, or you can see our previous episodes from this series or the previous series again on our series page, which is osualum.com/public health webcasts. And mark your calendars now because the series will return for season 3. Yes, season 3, beginning on Tuesday, February 2nd. You'll get more of Allison, not so much of me, but you get more of Allison and some wonderful faculty members, maybe some PhD students and other students, alumni from Oregon State University and the College of Public Health and Human Sciences. So stay tuned for that February 2nd, season 3. And again, the registration information will be posted on the website probably around the first part of the year.